Okay, we're going to go ahead and do the thoracic inlet release. It's the thoracic inlet diaphragm. The diaphragms are transverse tissue that support the longitudinal fibers in the body, the fascial fibers. So we're going to go ahead, and our hand placement is going to be at C7, T1, T2. So most of your hand is between the shoulder blades, with your thumb at C7. Anteriorly, you're going to have your thumb and index finger in the inferior margins of the clavicles. So below the clavicles, but touching them. Your hand on the sternum, your arm on the midline or relatively close to the midline. You're going to take your top hand off to no pressure, 0 grams of pressure, and then land on the surface as if you were a tiny, light little leaf landing on the surface of a stream, and follow whatever presents. So the fascia will begin to move, and for James, the posterior hand is moving clockwise, and the anterior hand is moving counterclockwise. We're going to hold at the barrier. There's a slight recoil sensation on these barriers in the fascia. The elastin fibers want to pull you back into the position you started from. Resist that with whatever amount of pressure it takes to hold the body in the new position, and wait for a settling, lengthening, softening, spreading, heat, or any other signs of release or change in the tissue. In this case, we get a widening and dropping toward the table sensation. Once you get that released, you can take your perceptual awareness into the lungs. So we got enough release here so that I can feel myself being drawn into the upper left lung. So you can move your hand in the front to accommodate that, or not. If we move to find the upper left lung restriction, it's just that much movement. So we're going to go ahead and now sink in, settle in without pressure, just with perception to the movement of the lung, which is felt as a lateral and then medial motion away from the midline for 4 seconds, which it's doing now. And then back toward the midline for 4 seconds. So let's move our attention up into the pleura, the tissue that surrounds the lung, and that's where we have the restriction. We're getting an opposite rotation of what we had in the whole diaphragm. We're getting, in this layer, a clockwise rotation posterior and counterclockwise rotation anterior. In the pleura, we're going to hold that. And just wait for release. There's a release. So the body is built in layers, layers within layers, containers within containers. And being able to move your perceptual awareness between the layers is important. So the diaphragm was first, we released that, and then we asked for the perceptual awareness of the pleura and the lung. And then we got a different sensation or feeling, and held that until that released. And now we get a much stronger movement in the lung on the left, going wide and narrow, much stronger than it was before. If you're not sure and you want to address or work with the right lung as well, just move over. Place your hand above the right lung and ask for the perception or the awareness of the right lung and pleura to come into your hands. And here we have a whole different sensation. We have a widening in the back, a pretty powerful widening sensation or pulling toward me. And in the front, it sort of moves a little inferior and holds. So we're holding that, as if the pleura and the lung want to come away from the midline. If I let it go, it feels like it's going to recoil back to the center. So we won't let it go. And there's a release. So settling back toward the table. So we've gone ahead and released the thoracic inlet. We've released the pleura, and we've released the lungs. James, any change in the way that feels?
Feels like I've got some loosening in the chest cavity.
Okay, loosening, does that mean in a
Less
way
tension.
less tension,
Yeah.
more space?
Right, yeah.
Okay.
More space, less tension.
More space. Okay, let's move on to the muscles.